Take a look at that number on your glucose monitor this morning. If you saw a 105, a 115, or a 130, your doctor likely gave you the standard speech. They told you that you are pre-diabetic or that your type 2 diabetes is progressing. They sent you home with a generic diet sheet, told you to walk more, lose weight, and handed you a prescription for metformin. But there is a massive piece of the puzzle that almost no one is talking about. While you are focusing on the sugar in your blood, your body is suffering from a silent internal robbery. Your system is currently being drained of 3 critical minerals. These are not just supplements. They are the fundamental biological keys that your pancreas requires to manufacture insulin and that your cells must have to actually use that insulin. Without these 3 elements, your blood sugar will continue to climb even if you do everything right. You can eat the cleanest salads, you can walk 10 miles a day, and you can take your medication religiously, but the needle won't move. Why? Because the problem isn't just what you are eating, it is what your body is missing. We are talking about 3 minerals so affordable that a monthly supply costs less than a single takeout meal, yet your healthcare provider likely never mentioned them. Why is that? The answer is uncomfortable. There is no patent on these minerals. There is no massive profit margin. There is no corporate interest in a solution that costs pennies a day. Instead, the system is designed to keep you on a cycle of expensive medications that you are expected to take for the rest of your life. But today, that cycle ends. You are about to discover the truth behind the 3 minerals that work to clear sugar from your bloodstream, assist in regenerating the environment of your pancreas, and protect your kidneys, your eyes, and your nerves from the ravages of high glucose. My name is Dr. Ethan Cole, and I am a specialist in natural metabolic health. For over 20 years, I have worked with thousands of individuals who were stuck in the same trap you are in right now. They came to me taking metformin, glyburide, or even heavy doses of insulin, asking the same heartbreaking question, "Doctor, why isn't my sugar coming down when I am following all the rules?" The answer was almost always the same: massive mineral bankruptcy. Your body simply cannot manage glucose without magnesium, chromium, and zinc. Without magnesium, your insulin is like a key trying to open a rusted lock. The signal just doesn't get through. Without chromium, your body has to work 10 times harder to process a single gram of sugar. And without zinc, your pancreas loses its ability to even package and store insulin in the first place. Statistics show that nearly 80% of people with type 2 diabetes are severely deficient in all 3. This isn't a coincidence, it is a biological crisis that is being ignored. Today, I am going to give you the exact protocol. Not just the names of the minerals, but the specific forms, the precise dosages, and the timing you need to follow so that over the next 90 days, your body can begin to reset. We want to see your A1C drop, your energy return, and your dependency on synthetic drugs decrease. But before we dive into the science, I need to know if this message is for you. If your fasting sugar is consistently over 100, if your A1C is above 5.7, or if you are tired of the tingling in your hands and feet, then you are in the right place. Take a moment to acknowledge that you are ready for a real change, not just a temporary fix. Subscribe to this channel and turn on your notifications, because the information I share here is exactly what the pharmaceutical industry would prefer you didn't know. Information that can save you years of suffering and thousands of dollars in medical bills. Before we fix the deficiency, we have to identify it. Your body is incredibly intelligent. It doesn't just fail, it sends out warning flares. Most people ignore these signals or write them off as just getting older. But these are actually the cries of a metabolic engine running on empty. I am going to list 15 specific red flags. I want you to count how many of these you have experienced in the last 30 days. The first flag is nocturnal leg cramps. If you are waking up at 3 a.m. with a calf muscle that feels like it has turned into a rock, causing excruciating pain, that is a classic hallmark of magnesium depletion. Your muscles cannot relax without it. The second flag is the involuntary eyelid twitch, that annoying repetitive jumping of the small muscles around your eye that you cannot control, is not just stress, it is your nervous system misfiring due to a lack of magnesium. Third, we have the sugar demons, the uncontrollable cravings for sweets or bread. This isn't a lack of willpower. When you lack chromium, your brain cannot effectively use the glucose in your blood. Even if your blood sugar is high, your brain thinks it is starving, so it sends out an emergency signal to eat more sugar. The fourth flag is constant hunger. If you finish a large, healthy meal and feel like you could eat again an hour later, your insulin isn't doing its job because it lacks the chromium multiplier. Fifth is post-meal fatigue. If you eat lunch and immediately feel the need to lie down or lose all focus, it means your blood sugar has spiked too high and stayed there because you lack the minerals to move it into your cells for energy. Sixth is slow healing wounds. If a small cut on your finger or a scrape on your leg takes 3 or 4 weeks to heal, your body is struggling to repair tissue. You cannot build new cells or fight off surface bacteria without zinc. Seventh is excessive hair loss. If you notice more hair in the shower drain or on your pillow than usual, your follicles are lacking the zinc necessary for protein synthesis. The eighth flag is white spots on your fingernails. You may have been told this is a lack of calcium, but in the world of metabolic health, we know this is almost always a sign of zinc deficiency. Ninth is frequent illness. If you find yourself catching every cold, every flu, or every urinary tract infection that goes around, your immune system is compromised. Zinc is the primary fuel for your white blood cells. 10th is interrupted sleep. If you fall asleep but find yourself wide awake at 2 a.m., unable to drift off again, you are missing the calming effect of magnesium on the brain's neurotransmitters. 11th is unexplained anxiety or a racing heart. If you feel a sense of dread or your chest feels tight without an obvious cause, your nervous system is in a state of hyperexcitability because it lacks the mineral dampener, magnesium. 12th is high blood pressure that refuses to budge. If you are on 2 or 3 different medications and your numbers are still high, it is because your arteries are constricted. Without magnesium, your blood vessels cannot dilate. 13th is chronic constipation. Your intestines are muscles, and they require magnesium to move waste through your system. 14th is a diminished sense of taste or smell. If food has started to taste bland or unappealing, your taste buds are likely suffering from a lack of zinc, which is essential for the receptors in your mouth and nose. Finally, the 15th flag is brain fog. If you walk into a room and forget why you are there, or if you struggle to find common words, your brain is struggling with glucose metabolism, which requires both magnesium and chromium. How many of these did you count? If you have 5 or more, you aren't just slightly deficient. You are in a state of metabolic bankruptcy. Every day that you leave these deficiencies unaddressed, your diabetes progresses, and your risk for irreversible complications grows. In the next section, we are going to look at why this is happening to you even if you think you are eating a healthy diet. We are going to look at the leaky bucket syndrome and how the very medications meant to help you might be making you worse. At this point, you might be asking a very logical question. Dr. Cole, if these minerals are so essential, why am I so low on them? I eat vegetables, I eat protein. How did I end up in metabolic bankruptcy? To understand this, I want you to visualize a leaky bucket. You can keep pouring water into the bucket, but if there are giant holes in the bottom, it will never stay full. Most people with blood sugar issues are living with a leaky bucket, and there are 4 major reasons why your mineral levels are draining faster than you can replenish them. The first reason is the dead soil crisis. This is a hard truth about modern life. The food our grandparents ate in the 1950s was nutritionally superior to what we find in supermarkets today. For decades, industrial agriculture has focused on yield and size rather than nutrient density. We use fertilizers that only put nitrogen, phosphorus, and potassium back into the earth, but we ignore the trace minerals like magnesium and chromium. A study comparing vegetables from 50 years ago to today found that some produce has lost up to 40% of its mineral content. You are eating a tomato that looks like a tomato, but biologically it is a hollow shell. You are eating more volume but getting less nutrition. The second reason is what I call the sugar flush. This is a vicious cycle. When your blood sugar is high, anything over 140, your kidneys go into overdrive. Their job is to filter that excess sugar out of your blood and dump it into your urine so you can flush it away. But sugar is a sticky molecule. It doesn't leave alone. As it exits your body, it drags magnesium, zinc, and chromium along with it. If you are waking up several times a night to use the bathroom because your sugar is high, you aren't just losing water. You are literally flushing your metabolic health down the toilet every single night. The third reason is a paradox that rarely gets discussed in doctors' offices. Your medications are robbing you. This is known as drug-induced nutrient depletion. Metformin, the most prescribed drug for diabetes, is famous for blocking the absorption of vitamin B12, but it also significantly depletes your magnesium stores. If you take a diuretic for your blood pressure, you are forcing your kidneys to excrete even more minerals. If you take an antacid for heartburn or gastritis, you are neutralizing the stomach acid required to absorb zinc. The very tools the system gives you to manage your symptoms are often the same tools that deepen the underlying cause of your disease. Finally, we have the stress loop. Every time you feel stressed, whether it's a bill you can't pay, a family argument, or the anxiety of your diagnosis, your body releases a hormone called cortisol. Cortisol is the enemy of magnesium. It forces magnesium out of your cells and into your bloodstream, where it is then filtered out by your kidneys. Because living with diabetes is inherently stressful, you are constantly burning through your calming minerals just to keep up with the day. You are pouring from an empty cup. And today, we are going to learn how to seal those leaks. Now we move into the heart of the protocol. We begin with the conductor of your biological orchestra, magnesium. I call it the master locksmith because it holds the key to your cellular energy. To understand why you need this, we have to look at the lock and key mechanism of insulin. Imagine your cells are like a house. To stay alive, the house needs fuel in the form of glucose. Insulin is the key that travels through your blood, arrives at the door of the cell, and tries to turn the lock. When the door opens, sugar enters, and your blood sugar levels drop. But here is the secret. Magnesium is the lubricant inside that lock. If you are deficient in magnesium, the lock is rusted shut. The insulin key can be perfectly fine, and you can have plenty of keys in your hand, but you turn and the door stays closed. This is what we call insulin resistance. Your sugar stays high in the blood because it has nowhere to go. The scientific evidence for this is overwhelming. A landmark study from Harvard University followed over 80,000 people for 2 decades. They found that those with the highest intake of magnesium had a 47% lower risk of developing type 2 diabetes. Another study focused specifically on people who were already pre-diabetic. When they supplemented with magnesium for just 6 months, over 70% of them saw their blood sugar normalize. They didn't just manage it, they stopped the progression in its tracks using a mineral that costs pennies. But I have to give you a very serious warning. Do not go out and buy the first bottle of magnesium you see on the shelf. Most grocery stores and pharmacies sell magnesium oxide. This is the cheapest form to manufacture, but it is almost useless for your blood sugar. Your body can only absorb about 4% of magnesium oxide. If you take a 500 milligrams pill, your body only gets 20 milligrams. The rest stays in your gut and usually causes a laxative effect. You are essentially paying for expensive bathroom trips. If you want to heal your metabolism, you must use magnesium glycinate, sometimes labeled as bisglycinate. In this form, the magnesium is attached to an amino acid called glycine. This makes it incredibly easy for your gut to absorb, with absorption rates hitting 80 to 90%. More importantly, it doesn't cause diarrhea, and it has a profound calming effect on the nervous system. If you struggle with constipation as well as high sugar, your second best choice is magnesium citrate, which is also highly bioavailable. For the Dr. Ethan Cole protocol, the dosage is critical. You are looking for 400 to 500 milligrams of elemental magnesium daily. Look closely at the label on the back of the bottle. It might say 1,000 milligrams of magnesium glycinate, but in small print it says providing 150 milligrams of elemental magnesium. You must count the elemental amount. The timing is the final secret. You should take your magnesium in the evening about 1 to 2 hours before bed. There are 2 reasons for this. First, it relaxes your muscles and nervous system, allowing you to enter deep restorative sleep. Second, it is during those deep sleep hours that your body does its most intense cellular repair work on the pancreas. When you provide the master locksmith at night, you are giving your body the tools it needs to grease the locks while you sleep, so that when you wake up, your fasting glucose numbers can finally start to head in the right direction. Within the first 2 to 4 weeks of this consistent routine, the night cramps should vanish. Your anxiety will begin to lift, and the foundation for your 90-day reset will be firmly in place. But magnesium is only the first step. Next, we have to talk about the metabolic multiplier that turns your insulin into a superpower. The second mineral in our protocol is one that is rarely discussed in mainstream clinics, yet it is perhaps the most powerful tool we have for supercharging your existing insulin. I call chromium the metabolic multiplier. If magnesium is the locksmith that greases the lock, chromium is the worker that makes the entire process 10 times more efficient. In the world of biochemistry, chromium is a core component of something called the glucose tolerance factor, or GTF. Think of it this way. Imagine your insulin is a delivery driver trying to move boxes of sugar from the street into a warehouse. Without chromium, that driver is exhausted, moving slowly, and can only carry one small box at a time. This results in a massive backlog of sugar sitting in your bloodstream. However, when you introduce chromium picolinate into your system, it's like giving that driver a heavy-duty forklift. Suddenly, the same driver can move 10 times as much sugar in half the time. This means that with adequate chromium, your body doesn't need to produce massive inflammatory amounts of insulin to get the job done. This is critical because high insulin levels are actually toxic to your blood vessels and are the primary cause of weight gain around the midsection. By making your insulin more effective, chromium allows your pancreas to rest. But chromium does something even more miraculous. It kills the sugar demon. Have you ever wondered why you have those sudden overwhelming urges to eat bread, pasta, or chocolate, even when you aren't actually hungry? It isn't a character flaw or a lack of self-discipline. It is a biological SOS signal from your brain. When you are deficient in chromium, your brain cells cannot effectively absorb glucose for energy. Even if your blood sugar is 200, your brain feels like it is starving. It panics and sends a command: find sugar now. When you supplement with the correct dose of chromium, that signal finally switches off. My patients often tell me that within 10 to 14 days, they can walk past a bakery or see a bowl of candy and feel absolutely nothing. It is as if a frantic switch in their head has been flipped to the off position. There was a profound study conducted involving nearly 200 people with type 2 diabetes. They were split into groups, with one group receiving a placebo and another receiving 1,000 micrograms of chromium daily. In just 4 months, the high-dose chromium group saw their A1C drop by 2 full points. Their fasting blood sugar plummeted by 27%. They didn't change their medications. They simply provided the forklift their metabolism was missing. Why are you deficient? Because chromium is almost entirely processed out of modern foods. If you eat white flour, white rice, or processed snacks, you are getting zero chromium. Furthermore, as we cross the age of 50, our body's ability to absorb this mineral drops by half. This is why middle-age diabetes is so common. It is often decades of accumulated chromium depletion. For the protocol, you must look for chromium picolinate. This is the form that has been studied the most and has the highest absorption rate. The dosage I recommend for the 90-day reset is 400 micrograms per day. If your sugar is severely uncontrolled, some clinical studies go as high as 1,000 micrograms, but that should be monitored by your provider. Take your chromium with your largest meal of the day, usually lunch or dinner, because chromium works best when there are carbohydrates present for it to process. Now we come to the final and perhaps most protective mineral in our trio, zinc. If you have been told that your pancreas is failing or that your beta cells are dying, listen very closely. Zinc is the shield and the repairman for your insulin-producing factory. Most people don't realize that the insulin molecule itself is actually built around zinc. Every single molecule of insulin contains 2 atoms of zinc at its very center. Without those 2 atoms, the insulin molecule cannot fold correctly. It becomes folded junk that your body cannot use. Imagine a car factory that has all the steel, all the engines, and all the glass, but they ran out of wheels. The cars are sitting on the assembly line, but they can't leave the factory. That is exactly what happens in your pancreas when you are zinc deficient. Your beta cells work harder and harder trying to pump out insulin, but they can't finish the product because they lack the zinc center. Eventually, those cells burn out and die from sheer exhaustion. By supplementing with zinc, you are giving your factory the wheels it needs to get the cars out the door. This takes the stress off the pancreas and allows those tired beta cells to begin a process of regeneration. A 2019 study confirmed this, showing that diabetic patients taking 30 milligrams of zinc daily saw a significant improvement in beta cell function and a 1.5% drop in their A1C in just 12 weeks. But zinc protects you in another vital way. If you are diabetic, you are likely terrified of infections, foot ulcers, or wounds that won't heal. High sugar effectively numbs your immune system, but zinc is the battery that powers your white blood cells. Without it, you are defenseless. This is why so many diabetics suffer from chronic fungal infections, slow healing scrapes, and the never-ending cold. Zinc closes the wounds and wakes up the immune system. The leaky bucket is especially aggressive with zinc. When your blood sugar is high, you lose zinc through your urine 3 times faster than a healthy person. It is a catch-22. The more you need zinc to fix your sugar, the faster your high sugar drains your zinc. To stop this, you need the right form. Avoid zinc oxide. It is essentially crushed rock and only 7% is absorbed. Instead, look for zinc picolinate or zinc bisglycinate. These are highly bioavailable and gentle on the stomach. The target dose is 30 to 50 milligrams per day. One critical tip: never take zinc on an empty stomach, or you will experience intense nausea. Always take it with a substantial meal. Also, avoid taking it at the exact same time as a calcium supplement, as they compete for the same doorway into your bloodstream. I recommend taking your zinc with breakfast to give your immune system and your pancreas a strong start to the day. In the next section, I am going to show you how to tie all three of these minerals together with the cofactors, the vitamins that act as the glue for this entire protocol, and I will give you the specific 90-day timeline of what you can expect to feel as your body finally moves from bankruptcy into abundance. Now that you understand the big three minerals, we must discuss how to weave them into a daily rhythm that creates what I call metabolic synergy. Taking these minerals individually is helpful, but when you combine them with specific cofactors, the biological glue that holds the system together, you create a 90-day reset that is far more powerful than the sum of its parts. Let's look at your new daily schedule. In the morning, with your breakfast, you will take your zinc picolinate, 30 to 50 milligrams. Remember, always with food. But at this same time, you must add the first of our cofactors, vitamin D3. I recommend 4,000 to 5,000 international units. Why? Because vitamin D3 is not actually a vitamin. It's a prohormone that acts as the master switch for your insulin receptors. Think of it as the electricity that powers the locks. Magnesium is greasing. Without vitamin D, your cells remain deaf to insulin's signal. Along with your morning zinc and D3, you should take a high-quality omega-3 supplement, providing at least 2,000 milligrams of combined EPA and DHA. Omega-3s reduce the chronic inflammation that is currently on fire in your pancreas and blood vessels. At midday, either just before or with your lunch, you will take your chromium picolinate, 400 micrograms. This is also when you should introduce a methylated B complex. If you are taking metformin, this is non-negotiable. Metformin is a known thief of vitamin B12. Without B12, the protective coating on your nerves called the myelin sheath begins to dissolve. This is the root cause of the burning, stinging, and numbness known as neuropathy. By taking a methylated B complex at lunch, you are providing the raw materials to repair those nerves and assist in the metabolism of the carbohydrates you just ate. In the evening, 1 to 2 hours before bed, you take your magnesium glycinate, 400 to 500 milligrams. To maximize this, add vitamin K2 in the MK7 form, about 200 micrograms. Vitamin K2 is the traffic cop of your cardiovascular system. Diabetics often suffer from stiff arteries because calcium ends up in the artery walls instead of the bones. Vitamin K2 works with magnesium and vitamin D to pull that calcium out of your heart and pipes, keeping your blood pressure stable and your circulation fluid. Now, let's talk about the mineral killers. You can take all the supplements in the world, but if you don't change your timing, you are wasting your money. The biggest culprit is coffee and tea. They contain tannins and oxalates that bind to zinc and magnesium like a magnet, dragging them out of your body before they can be absorbed. Never take your supplements with your morning coffee. Wait at least 1 hour after your last sip of coffee before taking your protocol. The same applies to grains. If you eat bread, oats, or beans, they contain phytates, anti-nutrients designed to protect the seed. These phytates block mineral absorption. If you are going to eat beans or brown rice, soak them overnight in water with a pinch of salt and then discard that water. This unlocks the minerals and allows your protocol to actually work. What will this feel like? In weeks 1 and 2, the first thing you will notice is the calm. Your nervous system will stop being in a state of high alert. You will fall asleep faster, the leg cramps will cease, and that persistent eye twitch will vanish. By weeks 3 and 4, the sugar demon will begin to starve. You will notice that you aren't thinking about snacks every 2 hours. Your fasting blood sugar numbers will likely begin to drift down by 10 or 20 points. By weeks 5 through 8, your energy levels will transform. The heavy comatose feeling you get after eating will be replaced by steady, reliable energy. If you have slow healing wounds or skin issues, you will see them finally begin to close and clear. Finally, in weeks 9 through 12, we see the structural changes. This is when your A1C typically drops by 1 to 2 points. Your blood pressure often stabilizes, and your doctor may begin to suggest lowering your medication dosages. This is the 90-day reset in action. I know that for many of you, this sounds almost too simple. We have been conditioned to believe that chronic disease only responds to complex, expensive chemical interventions. But the body is a biological machine, and machines run on parts. When the parts are missing, the machine fails. When the parts are restored, the machine heals. Let me tell you about Elena. She came to see me after 10 years of living with type 2 diabetes. Her A1C was a staggering 9.1, and she was terrified. She described the pain in her feet as thousands of stinging bees that never slept. She was taking maximum doses of metformin and was weeks away from being put on insulin. We started her on the full 90-day protocol, specifically focusing on high-dose zinc for her immune system and methylated B vitamins for her nerves. Within 6 weeks, she told me the bees had mostly left. Within 4 months, her A1C dropped to 6.9. For the first time in a decade, she could walk through the park with her grandchildren without crying from the pain in her feet. Then there was Marcus, a man in his late 40s who had just been diagnosed as pre-diabetic with an A1C of 6.3. His doctor told him to wait and see, which is the most dangerous advice you can give. It's like seeing a small fire in your kitchen and saying, let's wait and see if it burns the whole house down. Marcus refused to wait. He used the Magnesium and Chromium protocol religiously and eliminated processed grains for 90 days. When he went back for his checkup, his A1C was 5.4. He had moved completely out of the danger zone, lost 15 pounds of visceral fat, and his blood pressure normalized without a single prescription pill. Finally, consider Sarah. Sarah had a deep personal fear of diabetes because she watched her older sister suffer through kidney failure and blindness before passing away at age 70. Sarah's fasting sugar was 175, and she felt she was staring at a death sentence. We used the pancreatic shield approach, using 50 milligrams of zinc and 500 milligrams of magnesium daily to protect her remaining beta cells. In 6 months, her sugar was consistently under 100. She told me she felt like she had been given a second life, one where she wasn't a victim of her genetics, but a master of her biology. The decision you face today is a fundamental one. You can continue down the path you are on, a path of management where you simply watch your health slowly erode while your medication list grows longer. You can stay in the system that treats your symptoms but ignores your bankruptcy. Or you can act today. You can choose to provide your body with the 3 critical tools it has been screaming for. Magnesium, chromium, and zinc are not alternative medicine. They are the requirements of human life. You can go to any store today or go online and find these supplements for less than the cost of a daily coffee. Start the 90-day protocol. Monitor your numbers closely. Work with your doctor to adjust your medications as your body heals. Do not wait for the neuropathy to become permanent. Do not wait for your vision to blur. Do not wait for the system to tell you it's too late. Your body wants to heal. Your pancreas wants to function. Your cells want to receive energy. All they are waiting for is you. I am Dr. Ethan Cole. If this video has opened your eyes, I ask you to share it. There are millions of people trapped in the metformin cycle who have no idea that their problem is a mineral deficiency. You could be the person who saves their life by simply hitting the share button. Subscribe for more deep dives into metabolic health and check the description below for the full summarized protocol. Correct your deficiencies, regenerate your system, reclaim your life. I will see you in the next video.